Welcome to this explainer. Let's crack a fascinating medical mystery involving feline hepatic lipidosis, or fatty liver disease.
Think about it. Why would an overweight cat starving itself suddenly trigger a life-threatening crisis?
Meet our patient. She's an 8-year-old American Shorthair. She's lethargic, completely jaundiced, and hasn't eaten in a week.
Her vitals are alarming. We're talking hypothermia, a racing heart, and completely silent, paralyzed gut sounds. The real motive behind this rapid physical decline? It's actually a desperate, lethal metabolic survival response.
Here's the vicious cycle. Stress triggers anorexia, which floods the liver with fat, causing nausea and worsening starvation.
Now, let's examine the forensic evidence. First up, we're looking at severe cellular trauma in the blood.
The feeling liver stops producing glutathione. Because of this oxidative stress, Heinz bodies form on the red blood cells.
Those Heinz bodies literally destroy the cell's elasticity, causing red blood cells to rupture and creating severe anemia.
Also, look at this massive platelet clumping. It's another super dangerous anomaly in our hematology report.
Why does this happen? Well, high blood lipids harden the platelet membranes, making them stick together uncontrollably.
Plus, all that fat overload triggers reactive oxygen species, which attack liver cells and massively spike white blood cells.
Moving on to the biochemical panel, let's connect these numbers to find out what caused that severe jaundice.
Her extremely high ALT confirms liver cell death, while elevated GGT points straight to completely blocked bile ducts. Basically, fat-swollen liver cells literally crush the bile ducts, forcing bilirubin backward into the blood. Hello, jaundice.
But what explains those completely absent gut sounds we saw clinically? For that, let's check the electrolytes.
Wow, look at this. The cat's potassium levels are sitting at a critically depleted 2.3.
This severe hypokalemia directly paralyzes the smooth muscles. That completely explains the sudden loss of gut motility.
As fat invades, the liver also fails to synthesize albumin, causing an immediate, dangerous drop in blood calcium.
Finally, let's look at our last piece of forensic evidence to crack this whole metabolic mystery, the urinalysis.
The urine shows spilling glucose, an inability to concentrate, and a highly positive reading for occult blood.
Severe stress pushes that glucose out, while those ruptured red blood cells dump hemoglobin directly into the kidneys.
Now, the exhausted kidneys can't even concentrate urine anymore thanks to massive electrolyte chaos and total starvation.
It's a tragic irony. The body's desperate attempt to survive starvation by mobilizing fat is exactly what destroys it.
So, can we break this vicious cycle before the body's own energy reserves become a fatal poison?